Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, joined with Heather and Courtney. So today we're talking all about laser hair reduction.
So we'll kind of break it down for you. We're going to talk about how it works, different devices to use or that can be used, what makes a good candidate for laser hair removal, and we'll walk you through the consultation and the treatment process.
Great. So let's kind of get into the science first. So how does laser hair removal or reduction work? So it goes back to one of the fundamental principles in laser medicine, the theory of selective photothermal lysis. So that's a mouthful, but what it is, it's basically a theory where we are using light energy to target something in the skin called the chromophore, which absorbs that light energy, heats it up, and destroys it. So it gives us its correct clinical endpoint. So for instance, if we're doing laser hair removal, we are targeting the pigment within the skin called melanin. And within that melanin, it accepts that heat. And due to that heat, it actually destroys or damages the stem cells in that hair follicle, which leads to that reduction that we see.
Yeah, to kind of break that down to just breaking down the word photothermal lysis. Photo meaning light, thermal meaning heat, lysis being destruction. So we're using that light to convert it to heat to destroy a specific target.
Yeah. And this is kind of important because with all of laser medicine, we are using different wavelengths of light. So these are properties of light that selective, things within the skin can absorb. So say you're treating melanin, which is pigment, or if you're looking at blood vessels, it's looking for hemoglobin or what's in red blood cells. Or if you're targeting water on the surface of the skin, these are all different targets for these for this light energy to create a clinical endpoint.
Yeah, I feel like we could do literally a 3-hour episode just on lasers because I know we say it all the time, but each laser really is created differently, and there's different methods of laser hair reduction. So you do have not only different lasers, but the different wavelengths, and they can affect each skin type differently.
Absolutely. And that's also great that we have different lasers that we can use for hair removal. So we can kind of use the right device for the patient's skin type and type of hair that they have. And it really allows us to customize the treatment. So let's go into those specific lasers that are out there and where we might use some of these lasers. So let's kind of go through some of the list of technologies that are out there.
So I think just to kind of explain the main difference between the lasers, we'll go into different names and stuff, but the main differences between the lasers, like Dr. Zain said, is the wavelength, but also you have to think about the medium. So a lot of the laser names are based off of what medium is used. And so a medium is just a particle. Usually it's like a crystal used to amplify that light. And I think when a lot of people hear the word laser, they think everybody knows what laser means, but not everybody knows what it actually means. Mm-hmm. So laser is actually an acronym. It stands for light amplification by stimulated emission of radiation. And so
that's a mouthful.
It is a mouthful. And so to kind of break it down, like we touched on with the different mediums and the wavelengths. So one example is the Alexandrite, which is a wavelength of 755 nanometers. This one does a really good job for the lighter skin types, but it's definitely not something used for the darker skin types because it's really targeting that melanin.
Yeah, and if you ever hear it called Alex, that's the same thing.
Yeah.
Mm-hmm.
Yeah, you also have your diodes, which are kind of controversial. I don't love diodes for hair removal. I don't think that the results have been nearly as significant as with like the Alex and with the 1064. That's just my experience.
I think it depends on the device. There are some great diodes out there, and one of the advantages I see with diodes is the speed.
Yeah,
you can get a lot. You cover a lot of ground in a short period of time. But yeah, I mean, it has its place for sure.
And I don't know if you mentioned this, but the wavelength is around 800 to 810 nanometers. So it goes a little bit deeper than the Alex. So it can be good for lighter skin types, but it can also be used for the darker skin types too.
Yeah. And then we have the 1064 ND-YAG. This is a popular wavelength to use because it safely treats melanin and darker skin types. So for laser hair removal, this is the one that I go to.
Yeah, I really like the 1064. I feel like there's no real hesitation. I mean, even for, patients who have tried like the diodes and stuff, I feel like, the 1064 is a nice alternative option.
Yeah. And to get a little nerdy, what is Nd:YAG? What does it stand for? So it stands for neodymium doped yttrium aluminum garnet. So
Bravo! Someone gets an A+ today.
Yeah, that yttrium aluminum garnet is the YAG, and so that's the crystal that creates amplifies the light into energy, and it uses those neodymium ions to help create that photon of light. And so it's getting a little like physiological and scientifical, but that's kind of the nerdy breakdown of it.
And there are other technologies out there. So there's also the Ruby laser, which is pretty old school. It was also used for laser hair reduction as well as also vascular purposes. It's a little higher risk, and it's not really in use that much, but it is one of those relics from back in the day. So it can be used. I'm sure there's some that are operating out there. So that is an option. And then IPL, intense pulse light, true laser. It's actually a broad spectrum of wavelengths that can also target melanin, but unfortunately it can also lead to potential complications. It's not as targeted. So it's not the best treatment. You can get away with it with lighter skin types or kind of really cranking down the energy, but it is higher risk and not something that I routinely recommend.
Yeah. And it's funny, even, with all of those different wavelengths being mentioned, you can still have the same wavelengths, but with different lasers. So for example, one laser that I've used in the past is the GenoMax Pro. It does have the dual wavelength with the Alex as well as the Nd:YAG. That one does have a cooling system where it uses cryotherapy essentially as like a spray. So as soon as you pulse it, you'll get that cold air as well. The one we have in our office is a Cutera XL HR, and that one actually has a cooling tip on it. So you can change the degree of temperature on there to help cool down the skin before you pulse. So all of them have their own little benefits, I guess.
And some use like, Zimmer or a cold spray to kind of keep the temperature of the skin cool enough so it limits the amount of damage that can happen.
Yeah.
Like I said, just all lasers kind of being created differently and kind of finding the right one for you is important.
Yeah. Let's talk about some good candidates. I mean, anybody who has unwanted hair is pretty much a good candidate, but Courtney, do you want to touch on other reasons why you want to do laser hair reduction?
Yeah. So specifically, the darker the hair, the easier it's going to be to treat. So your blonde hairs, your red hairs historically are not going to react as well as your darker, coarser hairs.
I think that Alex does a little bit of a better job compared to some of the others because it can target the thinner.
What about gray and white hairs?
Gray and white hairs,
Yeah,
unfortunately. So I always joke with my patients, you want to zap them while they're still got some color on them.
Dr. Zain's got a few on his neck.
Unfortunately.
Can we get a zoom in now? And the reason for that is, like Dr. Zain had mentioned earlier, is that the lasers are picking up on that pigment. So when you have a white or a gray hair that lacks that pigment, there won't be anything for that laser to find and focus on. So the darker the hair and the coarser the hair, the better it tends to respond.
So what do these gray-haired individuals do?
Suffer. Just kidding. There is an alternative, electrolysis, which you may have heard of. Electrolysis is a procedure where they actually are using this tiny little probe to go into the follicle, each individual follicle, to destroy that, tissue essentially. It is painful. It's tedious. I specifically like the laser for the larger surface area. And this is coming from someone who used to do electrolysis as well. I do like using the laser for the largest surface area possible. You're able to get the whole area in one treatment, where electrolysis, depending on how much hair you have, you may need 15 minutes, 30 minutes, 45. I mean, some people, especially like your PCOS patients who have a lot of hair, will require a long time to sit through, and it can be really tender. So that's where I think the laser excels. But again, the gray and white hair is electrolysis.
What about like fine vellus hairs?
It doesn't do a very good job, especially because they're just so thin. It doesn't really catch up on
Yeah,
it.
the coarser the better.
Yeah.
Yeah, I do find sometimes with my, like, sometimes those sideburn areas, they do well, I think, because they are a little bit coarser. But yeah, once you're getting into those really fine cheek hairs, the laser won't tackle that.
Yeah, I think dermaplaning is great for that.
Yes, yeah.
Yeah.
Big dermaplaning fan.
I think as far as other candidates for laser hair reduction, it's definitely worth considering somebody who has like folliculitis, so inflammation around the hair follicle. If they get razor bumps from shaving, I think HS is a big one too. So hidradenitis suppurativa, that is a condition where it's very centralized around the follicular sebaceous unit. So if you can destroy that hair follicle, it kind of helps relieve some of the symptoms.
And pilonidal cysts, they're really uncomfortable, and that can sometimes reduce the incidence of developing pilonidal cysts, getting rid of that hair in that gluteal area.
PCOS patients, definitely, I see a lot of PCOS patients, and I think it's been life-changing for them, to say the least. So people who have PCOS are more apt to produce or overproduce hair, essentially, in that beard distribution area. And so it can be extremely helpful in just managing that.
We saw a patient the other day. I had seen her, and she was also seeing Courtney too for her 1 month follow-up. She was doing laser hair removal on her chin, and the photos, the before and afters, are so dramatic,
That's
even
awesome.
just by 1 or 2 treatments.
Yeah, and by reducing like folliculitis too associated with those hair follicles, then we can kind of start reducing the post-inflammatory hyperpigmentation. And that's a huge game changer because a lot of people are self-conscious about that.
That's exactly what I was going to touch on, is especially people of color who have that hyperpigmentation from the hair and may have been plucking or waxing, which just kind of contributes to that. I love pairing that with a lightening agent like hydroquinone and seeing the difference, not only in the hair reduction, but the brightening of the area. It's my favorite thing to see before and after.
As a personal story for myself, I mean, I used to get a lot of folliculitis from shaving. Like I did all the best practices, using, warm water right after, getting a shower, using my shaving cream, soothing gels, shaving with the grain and everything, and I would just break out all the time. So I decided to finally do laser hair reduction, and within 6 months, I stopped having to shave from my Adam's apple down. Don't get those painful cysts anymore or that PIH, and I haven't shaved in over 7-8 years now, and it's awesome.
Yeah.
So it can be a game changer for guys too.
Yeah, I've treated a lot of backs, chest on my male patients. Yeah, beard line, necks. We've treated your neck several times. So.
And we have those patients who want total body, which we
Oh.
have today.
They want to be as smooth as a dolphin's.
Yeah. So I think those are all in the realm of good candidates. And if you do have that more blonde vellus hair, for example, I know my upper thighs, for example, I would not be a great candidate because more than likely you'll be spending more money than you would like to for very little, if any, results. So just keeping that in mind.
Yeah, so let's also talk about treatment expectations. So most people tend to need 6 to 8 sessions to see a significant reduction, usually 4 to 8 weeks apart, but it depends on how far into the treatments you are, as well as the treatment area.
Yeah, my guideline normally, and a lot of times you have patients who want to treat multiple areas. So, for example, the underarms and the legs, or the face and the legs. So, typically I've done 6 to 8 weeks on my legs, Brazilians, and then about 4 to 6 weeks on the underarms and face. So 6 weeks I find to be a pretty good
Happy medium.
happy medium.
And also one of the expectations, so just kind of breaking it down, colloquially, we all hear it as laser hair removal. It's really laser hair reduction, as you've seen us referring to this procedure multiple times during this podcast. But I always tell my patients there's going to be some maintenance that is involved with these treatments. You're going to get some little hairs coming, and you might have to do a little maintenance treatment here and there. And like Courtney, I mean, with your patients, you're usually seeing them a few times a year, maybe.
Yeah, I think the hope and the goal is to get around 80% reduction in hair. At that point, the maintaining, hopefully, depending on the area, will be very infrequent. I do find the face tends to be more hormonally driven. So I think typically I find that we have to upkeep that a little bit more than maybe the Brazilian or maybe the leg. So
Yeah.
I would expect, when I do my consults, I tell patients if we're treating the face, just know we will require more touch-ups, as time goes on.
But it can make the hair a lot thinner
Yeah.
and less noticeable.
Exactly.
So you don't maybe necessarily care about it. Like for me, like I got a hair, here and there, but it's not anything to write home about.
Yeah,
Yeah.
exactly.
I think you also have to consider people who are on medications or supplements that can stimulate hair growth. So like people who are on minoxidil, it can cause you to grow hair places you may not want it. Biotin supplements, protein shakes, people who are heavy on the protein shakes, and high carb diets too can definitely play a role.
I like speaking to just at that point on medications. I do love pairing, especially my PCOS patients, with a spironolactone or something of that nature, especially because spironolactone is an oral medication that we use for acne, but it's a androgen blocker, so it blocks the male hormone, which can kind of contribute to that beard appearance in our female patients. And I think the combination of utilizing that with the laser hair reduction just promises a much better result, and they can sustain those results longer.
Yeah, and there's also like a topical that we use in dermatology. It was previously known as Vanica or eflornithine. So currently off the market as a brand name, but I think you can get it compounded. And what this does, it just slows down the hair growth process. So sometimes pairing that with laser hair reduction can also impart longer lasting results.
Yeah. Other things you want to keep in mind too are seasons, because you do not want to be tan for this procedure. And so, kind of timing your sessions around more of that fall to winter is usually recommended.
It's kind of tough because like 6 to 8 treatments,
It's
6 to 8
hard.
months.
Yeah.
So, I guess if you're really invested in it, just be careful about the sun, wear sunscreen. It's really important.
Yeah, I find legs to be the biggest culprit. Face, I think most people are pretty good about wearing sunscreen on their face, especially those who are taking, laser sessions. They want to make sure that they're maintaining and that they're protecting their skin. But underarms, Brazilians tend to do okay during the summer, but the legs, they're tricky.
Yeah.
Let's talk about at-home treatments, because I feel like that's very popular now. There's so many options on the market. My opinion is that they're kind of underpowered. The light scatters in a way to where it's not going to give you that guaranteed, like 80%-ish reduction.
And these are like mostly IPL devices.
Yeah. So I think, I guess it's a good place to start, but it's not going to give you that significant reduction.
And if it's an IPL device, I just, I wonder about my darker skin patients, because IPL is not indicated for darker skin tones, and I think it poses a risk.
And what about those photosensitive patients? People with melasma, like that can worsen things. So you got to be really careful about that.
Yeah. So as far as if you have a consult, what are things that you should ask during a consult? I think the biggest thing, in my opinion, is checking to see what lasers they do. Do they have experience with skin of color? If you are someone who has skin of color, read reviews. I think that's the biggest thing. What other things do you guys think are important during a consultation?
Yeah, I think, asking the type of laser and the wavelength. And I would even encourage people to inquire about their settings. I have patients who come in and they've done 10 or 12 sessions of laser hair reduction, and the amount of hair that I'm seeing is baffling for someone who has had that many sessions.
Yeah.
So I think sometimes what happens is you see these Groupons or you see these deals, and maybe they're promising 10, 12 sessions, but the settings that they are using must be substantially lower than what I'm using, because to still have that much hair growth, by the 8th session, you should have, at least a 60% reduction.
And I honestly think it's because like a lot of these patients are going to med spas now. We don't know who's treating them, what their qualifications are, what their training is. And sometimes the protocols are built at these places so that they underpower, so they don't harm the patient, which is a good thing,
Yeah.
but they're not getting the results that they're looking for. So that's why it's really important
Yeah.
to go to someone who is experienced, understands the science. There's a lot of science and physics we talked about today. It is not something that you just pick up like a weekend course or just looking at a manual and just kind of going willy-nilly. You can do some serious damage with this.
Yeah.
So I do think that the protocols that a lot of these places have are underpowered. They underdeliver results, but it's to kind of keep the patient safe. But I think that it would be more worthwhile to go to someone who's qualified, who has extensive knowledge, and get the results that you're paying for. And honestly, like knowing what technologies that these places are using is so important. Like I had a patient who, unfortunately went to this Medi-Spa, and they had the right device. It was an Alex and ND-YAG laser. However, instead of picking ND-YAG on this darker skin patient, they forgot to change it from Alex.
Yeah.
And literally looked like a zebra, like
I've seen that
stripes
before, too.
of absolutely like depigmentation. It was horrible.
Yeah.
So I really do think that you have to be really careful about where you get your treatments done, who's doing them. And that's why I think the dermatology office is the best place. We treat skin disease day in, day out. We also understand like what lesions to look out for. Like you just don't want to go over any like abnormal looking lesion. 'Cause places, let's get rid of it with a laser. That's not the way to approach it.
Well, and even to speak to that, you shouldn't be treating really any moles or treating over any moles, because it can pigment that mole. It can cause a little bit of an abnormal appearance to it. I mean, I'm thinking back to our patient that we've removed the melanoma from. I'm treating her legs with laser hair removal reduction. And, there's a few moles that whenever I'm treating, I tell her like, all right, we're going around, because you just don't want to set yourself up for that risk, or the patient for that matter.
Yeah, I unfortunately have seen dermatology offices too have medical assistants do the laser hair removals. And I think you just have to be careful, even though you're going to a dermatology office, definitely ask your questions, make sure you're doing your treatments with someone who's qualified.
Yeah, the risk of burning someone is so significant with laser hair reduction. And I think that's why it's so important to, really question. And you're not being annoying when you're asking what someone's qualifications are, how long they've been doing it, what type of laser, what settings they feel comfortable with. Those are all things that your provider should be willing and happy to answer for you.
Yeah, and just for your information, the highest rate of litigation in any aesthetic procedure is laser hair reduction. So it tells you, like, you need to do things right. Otherwise, you can seriously harm patients, and, that can damage your practice and your reputation. Yeah.
So some things I know I talk about with my patients during their consult is, I can say this 110 times and people will still forget this, but shave before your appointment.
I think you give a good shave to your patients.
I have had men come in with like full bare backs, oh, I forgot to shave. That's an extra $100. No, but it is important to discontinue any waxing, any of the nairs or at-home treatments. I do normally recommend that people shave either the day before or the day of treatment, and that's because you want to get that follicle. When you are pulling that hair out of the follicle, the laser has nothing to tackle. So waxing and the nair and things like that will essentially make your laser treatment ineffective. So the shaving, making sure that the laser still has access to that follicle and is not being blocked by that hair without it being pulled out, is super important.
Yeah, I think sun exposure, trying to limit sun exposure, or even like tanning beds, spray tans,
makeup.
Self-tanners.
Don't
makeup.
come in with self-tanner. Don't come in with makeup.
Yeah.
It puts you at a higher risk for burning, and your provider doesn't want that, and you definitely don't want that.
Yeah.
So does laser hair reduction hurt?
It depends.
Who's asking?
Yeah, I think it definitely depends on who. Everybody's pain tolerance is different. I think it definitely depends on the area. In my opinion, the underarms are really not bad at all. I think the bikini is a little bit spicier. But we use different techniques to help with comfort. We use the Zimmer, like you mentioned, which is a very cold hose, and we can change the the amount of cold air that's blowing through that Zimmer to help kind of numb the skin almost.
Yeah, it almost serves dual purpose, right? It's numbing the skin a little bit with that cold air, but it's also cooling the temperature of the skin, giving that protection from the treatment too.
Yeah, to minimize side effects.
Yeah, there are things like Pronox, which is essentially laughing gas, nitrous oxide, and people do opt for that sometimes if they're treating a larger surface area or a more tender surface area. So something like the Brazilian or the full legs. My male patients who are not used to as much pain, their chest and back, they love the Pronox. And that just makes for a more comfortable setting and a more tolerable setting.
Yeah. I mean, and for small areas, topical anesthesia is still fine. We typically have our patients apply it to the area, half an hour to an hour before. But you don't want to use topical anesthetic compounds, especially these high concentration ones, over large areas because you can get lidocaine toxicity, and that can be deadly.
Yeah, and I think during the treatment process, if somebody can go without the topical numbing, that does help. Just have a guidance of where their pain is during the process, because that helps limit side effects too.
Yeah, I've heard different practices won't offer numbing because they want feedback from their patient to say, hey, this is feeling really tender, or, oh, I don't feel it at all.
Yeah.
And sometimes those little hints from your patient are really imperative to treat because, okay, I know that they're not really feeling anything. Maybe I can increase a little bit, or, oh, this is really hurting them. Okay, maybe I just need to come down a couple settings for this first go around.
And not only are we looking at pain, but we're also clinically looking at the skin, making sure there's no evidence of blistering or any signs of burns.
Yeah.
Which is not to be confused with perifollicular erythema, which is what you want to see. Yeah. So this can happen after your laser sessions. It's completely normal. This is where you will see kind of more red and bumpy. It's specifically around the hair follicle itself. So almost looks a little like folliculitis or, of that nature. But it's essentially a response from the laser with the follicle. And that's actually a good sign. I like to see that in my patients. So you can always take a Zyrtec or Allegra just to help with that histamine response. Usually it's pretty tolerable as far as after. I don't typically have patients complain of any lingering burning sensation or pain. I do feel like it's pretty in that moment where that pain is coming from.
Yeah, most people will describe it just as a little rubber band snap on your skin. Yeah. So for most people, it's tolerable.
Yeah.
After treatment, are there any things that you guys tell your patients to avoid?
Sometimes exercise. I think sometimes sweat can irritate the follicle. So,
intense exercise.
Yeah, exactly. Yeah. Especially the underarms, they get a little sensitive sometimes. I really don't have a lot of aftercare for my patients. I
avoid the sun.
Yeah, avoid the sun, wear sunscreen, especially on the face. But usually my patients don't need any special kind of like aloe or moisturizer or things of that nature.
Yeah. If it's really looking inflamed, then, I throw on a topical steroid that can calm things down a little bit.
Or like avoiding like hot showers or saunas. I mean, that's not as common to see a severe reaction with, but it could increase your risk for some lingering side effects.
So have you guys ever seen paradoxical hypertrichosis from laser treatments?
I have not.
Yeah, not yet. And I hope I never do.
So I have seen it. And it was a woman who was treated, I guess being undertreated elsewhere.
Do you want to explain what that is?
Yeah. So it's basically this rare side effect where you actually get increased hair growth with laser hair reduction treatments. And often it's due to being underpowered. So like almost the hair follicle gets stimulation from that laser and that heat, but it's not to the point where it damages it. It almost encourages this growth. So it gets a little bit coarser and more pronounced. So that's something to, take into account, and it really helps us or helps you as a consumer to pick a good provider for this, because even if you do an underpowered treatment, you can cause more harm.
Yeah, very true. That's probably why I've not seen it, because
That's right.
Yeah.
You do good treatments.
Yeah. I used to work with a provider, an esthetician who, man, her settings were like criminally low. And I know it's because she was scared, and I totally get it. But I would tell her, she would have like sometimes the jewels at like I don't know, 10 joules on like the Alex, and even less than that sometimes. And yeah, you just, as you learn laser, you just realize that sometimes, like I said, you almost feel like you're taking money from people. The session's just not going to be successful. So
yeah, and Courtney and I have touched on this a couple times as far as like during the treatment process, often we will be changing the energy or the joules just to get that adequate result that we're looking for. So we might start a little bit lower and then we increase it throughout.
Yeah. So there's the power of the laser, which is you'll see a J on the screen, which stands for joules. The milliseconds or the pulse duration is essentially how long the laser is sitting in the skin for. So you can change that pulse duration based off skin type, skin color. Typically you'll have a lower pulse duration, like, with a lighter skin versus darker skin, because you don't want that to sit in the skin and put them at risk of burning. Typically those are the two kind of settings you'll see on especially Alex and Yags. But that's why I think, asking your provider too can be really helpful. And especially if you're going to a new provider, I have people who have moved from out of town or out of state. And so they tell me, oh, well, I've done 2 or 3 sessions. All right, like, what are your settings? Like, what are we working with here? Because I just, want to get a good gauge on how well you've handled it and how you're responding.
Yeah. Another thing that I think is important for some of these patients who are having excessive hair growth, making sure that there's a thorough medical evaluation, making sure there are no hormonal imbalances like PCOS or any thyroid disorder, things like that. So that's something also to take into account.
Yeah. Yeah. Overall, it's one of my favorite procedures to do. I think the results are so life-changing for so many people. And, we just don't think about how annoying it is to have to shave every day. And for some of these people, like you mentioned earlier, they can get really painful bumps. So I think, I always joke around, like, I think it's such a great, birthday gift for like your daughters when they hit like 18, like just get them some laser hair removal, like who wants to shave for the rest of their life.
Yeah, it's a game changer.
Yeah.
Yeah. Agreed.
All right. So, that was a great talk on laser hair reduction. We talked about who are the ideal candidates, what type of lasers are out there, what to avoid, and potential complications. So, if you guys have any questions about laser hair reduction, just hit us up. We are happy to answer any questions you may have. But if you liked this episode, please subscribe and, comment below, and we'll be seeing you next time. All right. Skinside out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717